I'm Dr. N P Singh, Senior Consultant Internal Medicine in Skull Hospital, Chandigarh. Today we'll be talking something about diabetes. You know, diabetes is one of the common disease, chronic disease, and it has lot of complications. Control of diabetes, awareness about diabetes is very important. So we will be sharing few questions and I will be answering the questions. Yes.
So basically, what is diabetics?
Glucose is a main source of energy in the body, and you see insulin is kind of a hormone which helps in getting this glucose into the cells, and then that energy only. And in diabetes what happens is there is either deficiency of insulin or body is not producing there's insulin resistance or other factors like obesity which are not helping for in converting glucose into storage form, and the glucose remains high in the body and which has lot of complications.
Okay. How do I know I have diabetics, and what are the common signs and symptoms of diabetics?
You see, there are a lot of symptoms. In the beginning, patient may be totally asymptomatic, but later on, if the sugar levels are very high, patient comes with symptoms like polyuria, means passing more urine, difficulty, more polyphagia, he wants to eat more food, gets hungry, thirsty. So these are few symptoms, but if the disease is chronic, then there are other complications like pain in the legs, tingly sensation, then weakness. So these are few symptoms, but totally patient in the initial stage, patient may be totally asymptomatic. And there are few tests by which we can diagnose diabetes. First, fasting blood sugar levels should be done. That will tell us normal levels. It should be around 80 and 100. Then post-prandial means 2 hours after breakfast, we can do the sugar levels, and which is more than 160, then that means sugars are high. Then oral glucose tolerance test, another test, and apart from this, routine testing should also be done. Like there is one very important test, we call it glycated hemoglobin, HbA1c levels, which tells us what the 3 years sugar control. And this, if the sugar levels are like normally levels are around 5 to 6%, if in diabetes it should usually levels are more than 7%.
So what are the types of diabetics?
Mainly there are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes occurs mostly in children and adolescents. In type 1 diabetes, there is a total absence of insulin. And in type 2 diabetes, they occur in the around middle aged or after 40 years of age, but these days it can occur after 30 years also. And in type 2 diabetes, patients are usually obese or can be non-obese also. There's insulin resistance is there. And the management is slightly different. In type 1 diabetes, patients are totally dependent on insulin. We have to give insulin, but in type 2 diabetes, we usually start with diet control, and then we add oral drugs for control of diabetes.
Okay. Who is at risk for developing type 2 diabetics?
There are many risk factors. Firstly, family history is important. Usually, inherited. All the other factors are very important, like patients who are obese, sedentary lifestyle, stress. Also, all these factors, they can lead to diabetes.
So you already said what tests can be done to check for diabetics?
Tests like fasting glucose levels, post-prandial glucose levels, HbA1c levels. So by these tests we can diagnose diabetes.
Like I am only 35 years old. Can diabetics still affect me?
Yeah, you see, long time back, usually diabetes patient used to have diabetes after 40 or 50 years of age, but now because of the sedentary lifestyle, the commercialization and industrialization, and people are having bad habits, stress and strain is more. So there's a paradigm shift in age of diabetes. Like even now we are seeing patients after 30 years of age having diabetes.
Is it possible to prevent diabetics even if my risk is high?
Yeah, prevention, yeah, certainly prevention. That's why we awareness of diabetes is very, very important. Patients, like people should be told about keep their weight in control. Dietary habits needs to be changed. Like in Indians, they have more of high carbohydrate meals. So we eat more of starchy fats, starchy meals, and we should be like the people in general, public in general should be told regarding regular walk, exercise, and good diet. So fast food should be avoided. High meals like starch meals, high carbohydrate meals should be avoided. So certainly it can only delay diabetes, especially patients who are at risk of diabetes.
Will diabetics be cured if I take medicine as directed?
You see, with medicines and diet control, control of diabetes can be there. But if you say cure, there is no cure of diabetes. It's kind of one has to take medication lifelong. One should see the doctor very regularly. Testing should be done. Like HbA1c levels, very, very important test which tells about the three months regular 3 months control of diabetes. So we can determine whether control is good, fair, or is very bad. So it gives motivation to the patient also that his control is good. So regular follow-up is very, very important. Regular medication is very, very important, and diet control is very, very important.
What else do I need to do to control diabetics apart from taking medicines?
Apart from taking medicines, diet control is very important. Dietary charts are available with the doctor, or these days in every doctor's chamber, dietary consultation is available. Dietitian will tell us about the how much intake is there. She will tell us in detail the diet plans, and then regular walk, brisk walk, minimum 45 minutes to 1 hour of walking, or brisk walk, or jogging if possible. That is also good. So apart from medicines, walk and walk, exercise, and good dietary plan as recommended, because dietary plan are made according to the body weight, and that should be adhered to.
Does the diet for those with diabetics differ from that of those without diabetics?
Certainly, in diabetics diet should be we call it strictly diabetic diet. The low carbohydrates are recommended, and more of complex carbohydrates are taken, but the simple sugars are avoided. Then one should avoid starch, this high fat meals, because obesity is a very high risk factor for diabetes, and one should take adequate amount of fruits, and that's all regarding diabetes.
And so what are the complications and consequences of diabetics?
Diabetes has lot of complications. One is short-term complications and one are long-term complications. In short-term complications, suppose one misses a meal, one can suddenly the sugar drops too much, patient goes into hypoglycemia, and that is a very dangerous complication. And sometimes sugar levels become very, very high. We call it diabetic ketoacidosis or hyperosmolar non-ketotic coma. Patient becomes totally comatose. So patient should be told about this. Like I will like to tell you, any diabetic patient who has symptoms like sweating and palpitations, that means sugars are low. So we usually tell our patient that they should keep sugar in their pocket, or whenever they have any symptoms, they can take sugar in any form, like whatever sugars are available at home, a simple sugar that should be taken, and then doctor should be consulted. And when sometimes patients are not regular with the doctor's advice, and the sugars keep on very, very high, so they can have very serious complication. We call it diabetic ketoacidosis. That means the acid formation in the body, ketones, and that the breathing is faster. That is kind of medical emergency. The sugars are almost more than 800, 1000. So we need admission in such patients. So these are short-term complications. Long-term complications are those like patient, because diabetes is such a disease, it can affect any organ in the body. Like patient can have a problem in the eyes, we call it diabetic retinopathy. Patient can have complication in the kidneys, we call it diabetic nephropathy. Then nerves are involved. Patients have symptoms like numbness, tingling sensation, loss of sensation, paresthesia, severe pain in the legs. So we call it diabetic neuropathy. Then apart from these triopathy complications, other complications, diabetes can affect the heart, so chance of myocardial infarction, heart attacks are very, very high. Then it can, chance of strokes are very, very high. Then the blood pressure, which can have hypertension, so that is also there. So all these are long-term complications of diabetes.
Can the complications of diabetics be prevented?
Yes, diabetic complications can be prevented. But you see, we can, if the control is very good, we can certainly prevent the complication, like regular checkup with the doctor, then ophthalmological checkup, so that's also important.
My blood sugar is under control. Does this means I will not get diabetics complications?
Even if the blood sugars are controlled, but you can certainly develop complications, because blood sugar control, we have to see the glycemic variability, like HbA1c test is very, very important. And you see, even if with good diabetic control, after 10 years or so, a patient can have any kind of complication like diabetic retinopathy, I told you, in the involvement of retina, then neuropathy and nephropathy, kidney involvement. I think kidney CKD, chronic kidney disease, or renal failure we call it, is a very, very important complication of diabetes. And many of the patients, if they are uncontrolled with diabetes, they land up with dialysis, or we have to go in for a renal transplantation in such patients.
So even can diabetics lead to serious emergencies?
Yes, certainly. I told you there can be serious emergency. We call it diabetic ketoacidosis, in which sugar levels are very, very high. Then sometimes patient can have hypoglycemia, sugar levels are very, very low. So acute complications are there in diabetes. Yes, certainly.
Okay. Can I fast if I have diabetics?
Yeah, you can fast, but one should be very careful. One should avoid fasting, but if his ritual is very, very important for the patient, then one should go in for regular monitoring. If the sugar levels are less than 70 or is more than 250, then one should consult the doctor.
So sir, these are the questions from my side. Would you like to address anything from your side also?
I would like to say one thing, that diabetes is like an epidemic in India, not in India, even Southeast Asian countries. It's such a chronic disease, and it has a lot of complications, long-term and short-term complications, and it adds to a lot of the economic burden to the patient as well as to the country. So control of diabetes, early detection of diabetes is very, very important. And one can avoid so many complications if one is visiting a doctor regularly, keeping HbA1c level less than 7%, and regular follow-up with the patient is very, very important. So prevention, as everybody says, is better than cure, and that I will still emphasize early detection, education, and regular follow-up is very, very important for the prevention of diabetes, control of diabetes, and preventing long-term complications. Thank you.